In tonight's Health Watch, Southwest Washington is celebrating a milestone this month.
It's been 25 years since the Heart and Vascular Center's cath lab opened at Southwest Washington Medical Center, and some of the people there have been there from the beginning and are still there today.
It's one of those things you may not realize is there until you need it. And in the early 80s, cardiologist Tom Kovaric realized Southwest Washington needed a catheter lab.
So we started in '82 thinking about getting permission to build a cath lab. Our hospital was growing, our county. And after a long process, we opened our first catheterization lab on July 18th, 1984.
25 years later, Dr. Kovaric is still saving lives and working on hearts in Southwest Washington Medical Center's cath lab in the Heart and Vascular Center. And so are many of his colleagues.
Actually, 3 out of the 4 cardiologists that were here on our first day when we opened up the lab are still here and still working and still helping people.
Another one of the cath lab's pioneers is Dr. John Greves.
Every day I see patients that I started with in their 60s with some kind of major problem that are now in their 80s or 90s, and it feels very, very good. I saw a gentleman yesterday that I thought the chances that he would survive several years were very remote, and I think this was our 26th year together.
The staff at the cath lab has performed 25,000 heart procedures in its first 25 years. Everything from removing blood clots to repairing aortic aneurysms in the chest and abdomen. The cath lab boasts some of the most advanced technology available.
And everything that is live here, you're able to see in the control room.
It's full of diagnostic image equipment, which helps doctors get a look inside without opening you up. And it's a biplane lab, which means there are 2 X-ray sources. That gives doctors, nurses, technicians, and radiologists 2 separate views with just 1 injection, which saves time and limits the amount of contrast dye they need to pump through your arteries. 25 years after its opening, doctors say those advancements in technology are helping get people healthy.
So cardiology's been really a rapidly advancing field in which there's been a lot of new technology, and it's really resulted in better treatment for our patients. And now when you have a heart attack, we don't just put you on the back ward and give you morphine.
And for nurse Pat Jimmerfield, who's also been there since the beginning, the cath lab has made a huge difference for patients in Southwest Washington.
And it was nice to have surgery here, because like the doctors were saying earlier, it's hard for the patients to go to Portland. They were elderly. They didn't drive. And some of their family members took them to the hospital and then picked them up on their way home from work that evening. So not only did you have the patient that was undergoing, treatment in Portland, but you had the poor spouse that was getting tired and exhausted.
And we looked at this community and thought we ought to have a cath lab here, because before that, we had to take our patients over to Portland, and it was difficult and disruptive for the family, moving the patient to another hospital.
But not anymore. As the community celebrates the 25th anniversary of the cath lab, the people who work there are looking ahead to what the next 25 years will bring.
But watching it grow in Southwest Washington from a very rudimentary laboratory to a beautiful Heart and Vascular Center with 5 labs, I mean, it's been very exciting.
Kimberly Moss, the 5 o'clock news.
If you'd like to learn more about the cath lab or the Heart and Vascular Center at Southwest Washington Medical Center, go to kptv.com/SW Health.